The war in Gaza has reached another bleak milestone. More than 30,000 Palestinians have been killed. Medics are working tirelessly to save all they can, but the conditions are absolutely dire. Just how bad is the situation on the ground? Hello and welcome to Roundtable. I'm Enda Brady. Now, the figure of 30,000 deaths in Gaza is a reminder of the extraordinary human toll of Israel's campaign. There are doctors and nurses working miracles despite the overwhelming circumstances. This is their everyday reality.
One of the bloodiest days so far. Over 100 people dead as they waited for food. Scenes of chaos as bodies are brought into the few remaining hospitals. But there isn't enough space.
Our Shifa is full of injured and martyrs, and there are no medics. They brought us to Kamal Adwan hospital because there was no one to help us.
Only 7 out of 24 hospitals remain open in northern Gaza, according to the World Health Organization. It says they're only partially functioning, with not enough staff, supplies or fuel for the number of people injured.
The system in Gaza is, well, we said it many times, it's on its knees, it's more than on its knees.
The situation here in Rafah is catastrophic. There is no electricity, no clean water actually. I managed to get this good internet, by the way, because I'm at the hospital and we have a generator here. See, the hospital is not completely furnished.
For months, Dr. Maghrabi and his colleagues have been doing what they can, and the bodies keep coming. Ultimately, though, too many have ended up here. These men used to construct buildings. Now they dig graves. Until there's a ceasefire, there's a lot of work to get on with.
Well, let's meet our guests. Dr. Margaret Harris is a spokesperson for the World Health Organization, and she joins us from Geneva. Here with me in the studio is Dr. Omar Abdel-Mannan. He is a pediatric neurologist and co-founder of Health Workers for Palestine. That's a global grassroots movement of health workers standing in solidarity with medics in Palestine. And Dr. James Smith, he is an emergency medical doctor. James worked at the Al-Aqsa Hospital in Gaza with Medical Aid for Palestinians, which is a British charity. Margaret, I'll come to you first. Just what's your reading of how catastrophic the situation now is in Gaza?
We've run out of words to describe it. Every hour things get worse. And my colleagues here are in a better clinical position to explain. But when we're seeing children dying of dehydration, of starvation, when you would expect the malnourished children to be killed by infection more quickly than dehydration and starvation, it means there's absolutely no food. There's absolutely nothing that their parents can do for them, that can bring to them. And to ask medical professionals, as well as the parents, to be able to deal with something that's impossible to deal with is, for us, we cannot understand how the world is letting this continue to happen.
Why is the world allowing this to happen, Margaret? People are screaming out with anger, and yet nothing is being done.
Precisely. It's very clear that the only solution here is a ceasefire. Even the tiny amount of aid that we can bring in can hardly reach, first of all, the huge numbers of people who need it, but we can't even bring it to many of the hospitals in the north. We only reached some hospitals for the first time in months last weekend because the roads are impassable, the checkpoints stop everything. When we try to evacuate patients, the people who are with us, the ambulance drivers, get pulled out and checked, sometimes taken away. We don't see them again. So it's a situation where it's impossible to provide just standard healthcare. It's impossible to provide the aid you need to be providing. And if this was an earthquake or a disaster, you would be frustrated, but at least you know that eventually it's going to be fixed. But this is a man-made disaster. This is a disaster there is no reason to be having. And the world has to say stop.
Margaret, in your opinion, is this a deliberate strategy by Israel to target the hospitals and dismantle the healthcare system in Gaza?
Certainly, we are seeing that despite international humanitarian law, despite the repeated calls by our organization and others, the reminders that hospitals, healthcare workers, healthcare systems are protected under international humanitarian law, we're continuing to see destruction. We're continuing to see attacks. We're seeing prevention of the provision of aid and the killing of medicals and nursing staff and ambulance drivers. When we go to the hospitals now, many of the people working there are volunteers, not medically trained, but they're doing what they can. They are just people who want to help. But the hospitals themselves are running out of the experienced, trained people to provide the care.
James, you've recently come back from Gaza where you were working in January. Just spell out for us your experiences and how bad the situation was.
Sure. I mean, the situation really is far more horrific than I think even the most attentive media outlets have been able to convey. That was certainly my feeling coming out of Gaza and being exposed again to the media cycle, certainly in the UK, that nothing really seemed to adequately describe what I had seen. Certainly in my career as a humanitarian health professional, I have never seen anything like that, like what I saw in Gaza. And that was corroborated by many humanitarian workers who are far more experienced than myself. Many colleagues who had 15, 20 years of experience were saying that this is unlike anything they've seen in their entire careers. The sheer scale, scope, and intensity of violence that Israel is currently perpetrating against the Palestinian people is unprecedented. Certainly from a medical perspective, the sort of the volume of patients we were seeing on a daily basis, the severity of injuries, it was almost impossible to do anything for those patients with the limited resources that we had available to us at that time.
Omar, your take on what's happening right now and what needs to happen?
I think the two previous guests have said it. It is apocalyptic, it is catastrophic, and what's horrific is that this is continuing now, 4 months in. This is 100% man-made or Israeli-made. And seeing pictures of Yazan Al-Kafarana, a 13-year-old boy with cerebral palsy who literally wasted away down to the bone. Seeing those pictures of a child acutely malnourished, and he is one of many. There are at least reports of 16 children that have died from starvation, including premature babies on neonatal units. This is what happens when you have bombed hospitals, when you have stopped healthcare infrastructure from working, and when you have stopped aid from coming in for 4 to 5 months. We are now seeing what was previously the tip of the iceberg. We are seeing the actual bottom. We are seeing the excess mortality. We had reports from the London School of Tropical Medicine recently outlining what would happen in a worst-case scenario, which is escalation, a continual scenario, or a best-case scenario. And in every one of those cases, we are seeing tens of thousands, if not hundreds of thousands of deaths that are happening and are about to happen. So my take is this situation is untenable. We are at a stage where, a precipice where, unfortunately, our political leaders and our policymakers are unable to do anything, or they are unwilling to do anything. And if anything, they are abating this genocide in continuing. They are warmongering. They are threatening us with cutting down protests in London. Our own Prime Minister is enacting, essentially draconian measures to stop us from using our British values of protests, of emergency protests, because they can see that the people are angry. You've said it. The people are raging. They have had enough of watching the double standards. Ukraine was only, a few years back, and we saw the response to that. And now we see the response, or the lack of response, to Gaza. And it is unjust. It makes the most mild-tempered human being rage. We saw a man self-immolating himself in front of the Israeli embassy in the US, and we got no media coverage because they know that when people are at that stage where they are ready to set themselves on fire for a cause, then clearly something is crooked and very wrong with the system.
Margaret, I want to ask you about the political will to stop Israel doing what it's doing to the healthcare system in Gaza. I mean, which countries now need to step up and just say enough?
All countries. So again, speaking from the World Health Organization, we make it very clear, and it is our job to make it clear whenever there's an attack on health, what it is, where it's happened. Now, those who then take action at the political level. So at things like the Security Council. Now, we've seen a number of resolutions. We haven't got to the point where what all the organizations are asking for, which is an immediate ceasefire. We haven't seen that agreed to yet, but that is what we need. We needed this months ago. But if the world our generation is to be respected in any way in history, it must happen now.
What do you think, Margaret, the game plan is for Israel here? Because if you remove a healthcare system from 2.7 million people, life is completely unsustainable.
That's why the health system has this very special level of protection under international humanitarian law, because every one of us needs that basic right to healthcare, every society. And so it's exempt from the conflicts. You have a conflict, you have a conflict. But your health system, wherever you are, must be protected, because this is your means of continuing society. This is your means of rebuilding after whatever led to your conflict.
James, talk to me about the people you worked with in Gaza. I mean, the resilience to keep going, the professionalism, the courage to turn up every day at a place of work that could be bombed at any moment. Just talk us through the kind of people you were working with and their stories, please.
Yeah, absolutely. I mean, I have reflections on resilience and its limitations, and perhaps the harms of a kind of a resilience narrative. But I certainly met incredibly resilient, incredibly courageous individuals who were providing the best quality medical care they could provide under the most horrific circumstances. We were working every day alongside Palestinian doctors, Palestinian nurses, and this story really is theirs. You know, I'm here really to deliver messages that they have shared with me. I was in Gaza for 2 weeks. They have been working day in and day out since the very beginning of this escalation, and for many of them, they have known conflict their entire careers. If not this conflict, then the one that preceded it, and the one that preceded that, and so on and so forth. Many of the people we were working with actually were medical and nursing students or junior doctors fresh out of medical school. Those medical schools now have been completely destroyed by the Israeli military. But those recent graduates, some of them were more experienced in trauma care than some of the most senior trauma doctors that I've seen here in the UK. And that is a really horrific thing to have to acknowledge, that they, in their short careers, have seen patients with some of the most horrific traumatic injuries you could possibly imagine. And they have become very good at treating those kind of injuries. They were the best of us. They were the most incredible healthcare workers I've ever worked with.
And Omar, they're doing all this with no supplies, no equipment, no proper medicines. They just keep going.
Yeah, as James said, these are incredibly resilient people. And I echo what he said, is that narrative of resilience sometimes allows the continuation of violence because only Palestinians can go through this. No, they are human beings. They are resilient, but they are human beings, and we have to remember that. But they are working under horrific conditions. The whole healthcare infrastructure has gone. There are no functioning hospitals in Gaza. Let us not pretend that there are dysfunctional hospitals. There are places that are providing emergency care, but there is no chemotherapy for cancer patients. There is no dialysis for renal patients. There is no diabetes care. There is very little to no maternity care. life goes on, and yet these people are having, and these professionals are having to work in conditions where their own families are being bombed, their own colleagues are coming in dead through the door. And we've heard these stories, and this continues to happen day in, day out. And the double standards of the US having the audacity to drop aid in whilst also dropping bombs in, that just watching that made me feel sick to the stomach, because they come out and they say that, you know, aid needs to be delivered as soon as possible, and yet they are arming the same occupation force that is bombing Gazans and killing people in their hundreds and thousands on a daily basis. So, you know, in answer to what Margaret was saying as well, the UK government and the US government have so much to answer for. They have been arming Israel. And the only way, given that Israel has reached the point where it thinks it's above the law, the only way to start putting some pressure is to start applying some sanctions and stop arming them, stop giving them the same bombs that they are using. It is not enough to just say a ceasefire now or a permanent ceasefire now. This has to go beyond that. We have reached a stage where we have actually lost the respect of future generations. I'm sorry, this generation is lost because our children will look at us and think we have not done enough. Whatever we are doing, we are not doing enough. Because to allow a genocide to continue in 2024, live on our television screens, that is not good enough.
Margaret, how do you feel about the health workers of Gaza who have done so much with so little?
I can only repeat what my colleagues have said. They are the best of us. And they're losing their lives for being the best of us. My colleagues describe going to the hospital and seeing people who haven't slept for weeks and they're hardly getting any food. They don't have staff to replace them. They don't have anything, but they're continuing to work there and they're continuing to do what they can because other people need them so much. And again, I emphasize, how do we tell our children and grandchildren that we left people in to do that when we could have stopped this?
I just want to take a look at some statistics from Gaza. The ongoing conflict has resulted in the displacement of 1.7 million Palestinians, including crucial healthcare professionals, more than 600 incidents of violence against or obstruction to healthcare system since the outbreak of violence in October. More than 160 aid workers have been killed, making Gaza the single most dangerous place in the world for aid workers. And that's from the International Rescue Committee of the United Kingdom. And that's not to mention bombing of ambulances, Omar. 183 ambulances destroyed.
I think Gaza is the most dangerous place in the world to be a human being right now. To being a journalist, to being a medic, to being a child, a woman in labor or about to give birth. So this is not isolated. The level of systematic targeting of healthcare facilities is unprecedented. But it's not unprecedented in the sense that this has been happening in the West Bank and in Gaza for decades. It is now accelerated at a pace that we have never seen before. And there's a clear reason why they are doing this, because the end game is to starve a population, to make 90% of people rely on eating one meal every other day, which was the case 2 months ago. So God knows where we are now. And to not allow them to access care when they fall ill. So people will be dying in their droves. And these excess mortality figures are probably underestimates. By virtue of academia, when we publish papers, we always tend to underestimate. The reality is probably going to be grimmer than what we are being told. And again, as we've said, this can be stopped now. This could be stopped right now. If only the international community and the leaders stand up and say, enough is enough. Not in our generation, not under our watch do we allow a psychopathic state to continue starving, killing, and maiming Palestinians and dehumanizing them. We've seen the way the Israelis have been talking about Palestinians for years. And it has now been so clear that this has been a narrative built up to allow mass murder and genocide to occur in scale.
James, in your time there, I want to address this issue. Israeli rhetoric or propaganda constantly says that Hamas uses hospitals. Did you see any evidence of that? Because they've provided no evidence to back this up. And this seems to give them carte blanche to keep bombing people.
I certainly saw no evidence of that, and none of the colleagues that I have worked with in any of the healthcare facilities across the entirety of Gaza have seen any evidence of that. And I want to be categorically clear about that. That is an excuse that has been used to enable these attacks against the healthcare system as a means to systematically undermine and eventually destroy the entirety of the health infrastructure from the north to the south of the Gaza Strip. Even if it were the case that there were military activities ongoing around protected facilities, international humanitarian law, again, has put in place various stipulations that ensure that whatever military measures are taken need to be measured, need to be proportionate, and need to adhere to, again, a series of very strict rules. When we see raids on hospitals, the detention and torture of healthcare workers, more than 400 healthcare workers that have been killed, none of that is in adherence with international humanitarian law. There's absolutely no justification for what the Israeli military have done to healthcare workers and the healthcare system in Gaza.
Margaret, I want to ask you about maternity care. I mean, there will be many, many women watching this programme, watching this roundtable, who are expecting a baby, a joyful moment normally in someone's life. I'm guessing in Gaza right now, it's a death sentence.
A death sentence for mother and baby. If the mother's lucky enough to survive the delivery, she's then faced with trying to feed the baby. She's starving, remember? She's already been underfed for months. She's got so many of the women who have delivered newborns come in with these tiny starving babies, unable to feed them because their milk has dried up or they don't have adequate milk. And any mother who's breastfed will know what horror, what hell it is when your baby you can't produce the milk. But there's nothing else. There's no milk substitutes. There's no clean water. Those babies are dying. We've seen malnutrition go up from almost a very small percentage to 15.6% in the north and at least 5% in the south. And this was a survey done in January. This is unprecedented. We have never seen a level of malnutrition among children develop at such a rapid rate anywhere in the world. So again, we are creating an extraordinary, unbelievable medical hell. And you mentioned, and as you mentioned, women who are pregnant can't get unpregnant. They are going to deliver those babies, but there's nowhere or very few places where they can deliver safely. And as I said, it's almost very, very difficult for them to feed their children once they're born.
James, I want to end on some positivity. At some stage, this will end. Can the healthcare system in Gaza be rebuilt?
The healthcare system must be rebuilt. And I think we need to stand firm on that. It will be rebuilt. There can be absolutely no doubt about that. There are public health professionals, healthcare workers who are already starting to organise and to try and develop plans for what the rebuilding of the healthcare system will look like or should look like. Those plans obviously need to be led by Palestinians themselves. And what we really need now is a groundswell of support from across the medical, public health and global health communities to really invest in those plans and to be sure that, as we've discussed, once the bombs stop falling, that support can be rendered as quickly as possible and in a way that is effective and ethical.
Omar, we've seen 5 months of violence now. As you said, there are no functioning hospitals left in Gaza. Can you believe what we've witnessed? And as you pointed out, we've seen it. It's being documented. It's on television. It's on social media. And day after day, it just keeps getting worse.
I think short answer is I can, because I've seen it with my own eyes, the level of atrocities that have been committed by the Israeli occupation forces for years to Palestinians. If you study Palestinian history and the history of that land, you see what the Israelis have been doing to Palestinians for decades. So in some ways, it is not surprising. But what is horrific is the level and the mass scale of destruction and killing and genocidal attacks that have been taking place day in, day out. And as one doctor said to me very early on in the second or third week of the conflict, said, every day I wake up, I think the worst is over, and the next day is worse than the day before. And that is what we have seen, starting with a bombing of a hospital, then targeting of ambulances, then sniper fire on healthcare workers operating in an operating theatre, and then the killing of aid workers, the shooting of aid workers. So nothing, frankly, surprises me anymore. But what it should not do is desensitize us. It should give us impetus to continue as concerned citizens, not even as healthcare professionals, as people with some level of humanity, to keep pushing, to go on the streets, to up the ante, because our governments are not doing enough, or they are complicit. So it is time for us as people to allow this to change and to make this change happen.
You will go back out there again and work?
I would hope so. I would love to be able to go there and help in any way, shape or form. I am at the service of Palestinians and Gazans, and I hope so. And I hope it will be in a time when we can rebuild a healthcare infrastructure from scratch, but make it better and more resilient than ever before.
It has been an honour having you all on the show today. Omar, James and Margaret, thank you all so much for your insight. Remember, you can see more discussion and debate on our YouTube channel. Search for Roundtable TRT World. And if you like what you see, please do hit that subscribe button. But for now, from me and Brady and all of the team here, goodbye and thank you for watching.